Yo guys, welcome to our video today. It is a good year 2024 and we're going to share a lot this year. Kindly guys, if you have not subscribed to our channel, you can see the change in our channel name. It's Nazvin is our channel today. That is due to suggestions and also the input I got from you. You suggested we change the name and now we have Nazvin as the channel name. So today we're going to discuss about overactive bladder, and I'm going to explain what overactive bladder means. I'm going to state the causes, the treatment, the complications, and also management, and also the prevention part of it. And then we conclude about overactive bladder. Have you ever had to go to the loo 8 times, more than 5 times in a night, that you frequent the toilet to go and empty your bladder? That is a sign of an overactive bladder. But there are few signs and symptoms which you can associate it with. For example, overactive bladder or OAB is a condition characterized by a frequent, sudden urge to urinate, often resulting in involuntary bladder contractions, and some of the features which are all the symptoms which are associated with overactive bladder is urgency, frequency. By urgency we mean you always feel you want to urinate. Frequency, you want to urinate more and more. And sometimes we have what you call incontinence, where you are not able to control your urine, or you have inability to control the urge to urinate. So this is a very common condition, and it is good we know and how now we are going to solve it about the overactive bladder. So welcome guys. The channel is Nazvin, and that is what we're going to share a lot of on this channel. Kindly, if you have not subscribed, subscribe, support the channel, and also let us know where you want to take the channel, where you want us to take the channel for the next place. So guys, what are the causes of OAB or overactive bladder? Number one cause is about aging. On aging, we talk about changes in bladder function can occur with age, leading to increased frequency and also the urgency. Number two is about neurological conditions. By neurological conditions such as multiple sclerosis, stroke, and nerve damage can affect the bladder control. So the people with the stroke and also what we call multiple sclerosis, or they have nerve problem, they are likely to have a problem with the control of the bladder. Another cause can be the bladder abnormalities, like when we have structural issues of the abnormality in the bladder, which can lead to overactive bladder symptoms. We also have some medications which can affect you or that patient on how they're going to associate themselves with this condition. We have medications such as diuretics, or that is like now we have those heart-related medication which are supposed to handle especially the blood pressure and other issues in the body. So most of the time the diuretics and which work also on the kidney, they're likely to affect the frequency and also the urgency to urinate. Also certain antipsychotics, these are the drugs associated with the control which work on the mind, to control the mind problems, psychiatric problems. They are likely also to cause OAB symptoms or overactive bladder. Also, very special, so we have hormonal changes. Hormonal fluctuation, especially in women during menopause, can impact also can affect on how this condition can also be displayed at certain conditions. So when women get to menopause, it can also be one of the things which can lead to can OAB. They have a problem. Not everyone, but some develop this problem of overactive bladder at some point. Also, we have constipation, because constipation, chronic constipation, or constipation for a longer time or longer period can put pressure on the bladder and worsen the symptoms of the OAB. And also we have psychological conditions or psychological factors. When one is stressed or is anxious, can influence the bladder function and contribute to overactivity of the bladder. Or when all the causes are said and done, it is important to consult the healthcare professional to determine the underlying cause of overactive bladder and appropriate treatment and a plan based on the individual's specific situations. So this is for learning, but also you need to see your doctor to come up specifically on what you need to be done so that you get over this overactive bladder. So what are the options given or the treatment given for this overactive bladder? Number one is about behavioral therapies. Number one is about bladder training on behavioral therapy. So by gradually increasing the time between bathroom visits to improve bladder control. So one is trained on bladder, how often you are supposed to go and urinate or empty your bladder, so that you train your bladder to take control. So we also have scheduled toilet trips, going to the bathroom at a regular period of time, intervals, even if there is no immediate urge. It's very important that you have those scheduled way of emptying your bladder. It's also a good behavior to have time when you go and empty your bladder, because this really helps on the management of these problems, so that you get to control your bladder well. Also, pelvic exercises, the most common way and the most common thing on the ground about this pelvic exercise is on Kegel exercise. So this strengthens the pelvic muscle to improve bladder control, and also it can it strengthens the bladder muscles so that you can manage it very well. And also on another way of managing, or how this condition is managed, is about you go to you guys about the prevention. One is able to come up with the diagnosis of OAB or overactive bladder. Typically, it involves thorough evaluation by a healthcare professional, as we know, and that's very important to be evaluated by the healthcare provider. So, from the medical history, the healthcare provider will inquire about symptoms, their duration, and any factors that may affect the exacerbation of the condition. From the physical exam also may be conducted to assess the overall health, including checking of the signs, issues, or another condition that could contribute to the AOB or OAB. So bladder diary also very important. The patient is asked on how the behavior of the urination is, or the bladder pattern is, also on the fluid intake, bathroom visits, and episodes of urgency or incontinence. Providing valuable information can help in the diagnosis. Also very important, we do in the lab what is called the urinalysis to show urinalysis may be performed to rule out the urinary tract infections, because urinary tract infections also may may display themselves as OAB or overactive bladder, so or other issues similar with the symptoms. Also very important, we also get to check your aerodynamic testing, which is very important also, so that we get to find out what is happening with the measure of the bladder and urethral function, helping to assess how well the bladder is storing or releasing the urine part of it. So urodynamic testing is done also to do the same. We do also what is called cystoscopy. That is, in some cases, the cystoscopy may be recommended to examine the inside of the bladder, where some camera is introduced to the bladder, where now the doctor or the healthcare provider gets to rule out other potential issues in the bladder area. Also, imaging studies, imaging such as the ultrasound or the MRI, may be done to visualize the urinary tract and identify structural abnormalities, which may also be causing that kind of problems. Also, on neurological evaluation, we get to get additional neurological assessment to determine if the problem is related to that. So the specific diagnostic approach on making the diagnosis of the OAB or overactive bladder, it is individual based. So and circumstances also affect the same. It is crucial to consult with the healthcare professional to comprehensive evaluation and accurate diagnosis tailored to your situation. So guys, in conclusion, on overactive bladder is a condition characterized by symptoms such as frequent urination or frequent urgency, increased frequent urination, and sometimes urge to incontinence. So diagnosis of OAB involves thorough medical history, physical examination, bladder diary tracking, urinalysis, urodynamic testing, and in some cases additional procedures like cystoscopy or imaging studies can be done to determine the problem with the bladder. Once diagnosis management strategies may include behavioral therapies, lifestyle modification, medication, and severe cases surgical intervention. Seeking prompt medical attention and working with healthcare professional are crucial steps in effective management and improving the quality of life for individuals with OAB. If you suspect that you have overactive bladder symptoms, consult with the healthcare provider for personalized evaluation and guidance on appropriate intervention. Guys, the channel is Nazvin channel. This is where we get to talk matters medical in the simple language which you can understand. And guys, I want to welcome you to our next video. Welcome, guys. Guys, when we talk about the pelvic exercises, we're talking about the Kegel exercise, and which is very vital according to the condition of the this bladder problem. So the Kegel exercise gets to strengthen the pelvic muscles and also to get to the pelvic control. Also, we have life modifications like fluid management, where adjusting fluid intake, like avoiding alcohol and caffeine intake, is very, very important on the lifestyle. Also, the healthy diet. By this we mean maintaining the balanced diet to avoid foods that irritate the bladder at the same time. So the diet also plays a very important role in the lifestyle modifications as a very important aspect of the same. Also medications like anticholinergic medication. This medication helps to relax the bladder muscles. The beta-3 adrenergic agonists also, they play a very important role. An alternative class of medication that can also help relax the bladder. Also, surgery can also be one of it. For severe cases that do not respond to other treatments, we may have surgery like bladder augmentation, and neuromodulation may be considered. Also, we have Botox injections, that is injecting Botox into the bladder muscle to help control its overactivity. So the choice of treatment, guys, it depends on the underlying cause, the severity of symptoms, and individual health consideration, so they to help manage the problem. So consulting healthcare provider, especially your urologist or your doctor, who can give you professional advice, and also is very crucial in the determination, also to determine the appropriate approach to managing the overactive bladder. How can you prevent this overactive bladder? While overactive bladder may not always be preventable, certain lifestyle measures can help reduce the risk or severity of the symptoms, guys. So number one is about maintaining the healthy lifestyle, that is adopt a balanced diet and a proper nutrition. And also we advise you stay active, like you exercise, so that to support the overall health of your body. Also stay hydrated wisely, that is mark the word wisely, stay hydrated wisely. So maintaining the health fluid intake, but avoid excessive consumption of carbonated or alcoholic beverages, as they can irritate the bladder. Also pelvic floor exercises, so engage in Kegel exercises to strengthen the muscles that contribute to control the urination. If you don't know about the Kegel exercise, I talked about it in my previous video. Kindly go back and see on the Kegel exercise and how you're supposed to do it, because it is an exercise which has been scientifically proven to help many issues in our bodies. Also, manage chronic illnesses like diabetes or constipation. Follow what your doctor is telling you about this management of those conditions kindly, so that you get to get the proper attention, and also on the best way on how you can manage them. Also avoid smoking also, because of the caffeine, and also they suppose is likely to cause the irritation of the bladder. So quitting or avoiding tobacco can be very beneficial for you to prevent the overactive bladder. Also maintaining the healthy weight is a very important aspect. It's through being active and also keeping your weight within the recommended weight or BMI, body mass index, is very important to avoid obesity, because when you are obese, you are likely to predispose yourself to such kind of to this kind of condition, and sometimes it can be detrimental to your health. So practice bladder friendly habits, that is example of develop regular toileting habits. When you feel like you want to go to the toilet, it is a good habit that you go to the toilet, and avoid holding urine in extended period of time, so that you not to get into the problems of overactive bladder. While these measures may not guarantee the prevention of overactive bladder, the ones I've mentioned above, they can contribute to overall bladder health. If you experience symptoms of OAB, that is overactive bladder, or have concerns, it's very important to consult your healthcare provider for proper diagnosis and guidance on the management of the same. So we have some complications of overactive bladder. We have things like urinary incontinence, and this can be very embarrassing at some points, because they affect the daily activity and cause embarrassment. They impact the quality of life, because persistent urgency and the frequency to bathroom visits may interfere with work and social activities, the overall quality of life. Also sleep disruption, because frequent nighttime urination, that's what you call nocturia, can disrupt the sleep pattern and contribute to fatigue at the end of the day. Skin issues, urinary incontinence may cause skin irritation and infection if proper hygiene measures are not maintained. Also psychological impacts, because OAB can cause stress, anxiety, and depression due to the constant worry about bathroom access,